to say that Dr. Atul Gawande has put the picture most accurately. If you want to know how to go about healthcare in developing countries, particularly in Africa, just take what he has said. You need to start at the basic level. For most of the past years, we have worked on that topic and hopefully to trickle down. Health does not work that way. You have to start at the base and also address those things that are of public concern, of international concern. Identifying disease outbreaks. You do that at the grassroots level. You don't do that at the public level. And also responding to health threats and again, all programs of prevention. Everything happens at that level. Simply train health workers. And if you have extension workers or any kind of personnel who at that level are able to do the most simple tasks. Of course, the purpose is to provide healthcare. And 60% of the deaths in children under 5 from malaria, diarrhea, and pneumonia. And that can take care of, even at that level, to reduce mortality and also the mortality among women. Going back to what John spoke about, one of the weaknesses in our program, we have done very well, and thank you for all the compliments the HIV/AIDS response. But the weakest spot at the moment is the prevention of other child transmission of HIV. And that's because to be able to locate the program, we have to find the pregnant women and test them and also put them on treatment. Then we can avoid the prevention, we can prevent transmission from mother to child. But if you don't have a structured basic healthcare system, and if you do have systems that they don't look trustworthy, you get very low attendance. And so you can't actually get the mothers and put them on treatment. So unless you strengthen healthcare at that level, there are a lot of things you will miss out. And once basic healthcare is strengthened, then the rest of it is actually quite easy, relatively easy. So again, I want to join in saying that where you want to put your money is at the level of basic healthcare. And in Nigeria, we're trying to draw attention to that. I'm happy that Nigeria is one of those we are working with now to drive that with the population of around 14 million. We have a lot of relatively, we have a lot of, excuse me. We have a lot of room for investment, a lot of room for improvement. And if you look at the mortality rates and so on, they all come from the grassroots level. They're not in the cities. They're not really having big hospitals. So that's what we are addressing. In fact, all problems. Right now, we're talking about women and there's a lot of inequity. Actually, the inequity in healthcare between urban and rural, and between male who run the society and the females who are more or less not, many of them don't have the awareness or the education to speak for themselves. So education, their child education is very critical. It's part of what the investment that is required to allow child spacing, nutrition. And as far as nutrition is concerned, 50% of malnutrition in Africa is caused by just not knowing what to give. They have the right food, but they give the wrong one to the children. And if you just do a little education and they know exactly how to feed their children, they're going to reduce malnutrition by almost half. So the primary health care is also a location to educate people, educate the women, educate adolescents, educate their fathers, educate all those who are able to do the health at all on all the things that are necessary for reducing waterborne diseases, vector-borne diseases, vaccine-preventable diseases, and so on. So that area is the most important. With regard to cancer care, yes, that's also something that's growing. And there is, in fact, also evidence and anecdotal evidence that there's an increase in cervical cancer in women in the oil producing areas. It's not yet clearly established, but we are thinking that the pollution, the hydrocarbons and heavy metals, and metal use exploration might have a role to play in that regard. And the tertiary hospitals in that area are all complaining and beginning to say that we're seeing a strong increase in some cancers in these areas. So the evidence is still being collected. So the government is also putting a lot of emphasis on prevention and early detection. And where would that happen? Again, at the grassroots level. Before they get too serious and before they reach the tertiary level, where it becomes much more expensive and where the outcomes are much more unlikely to be successful. So if you catch them early at that same level, that's when you have the best results. The government is investing considerably in cancer care. We have 8 new cancer treatment suites, radiation therapy, and we are definitely in need of more of these investments. We're open to all models of investment, fully private investments, joint ventures, and also those that are working through international NGOs. Those ones are all open because, like, with a population of around 14 million, you have a very, very wide area that requires investments of all types. Some of these investments are being conducted by internal NGOs and local NGOs, and also by